Welcome. How can I help you?
Hi, we are here for an appointment at 9 a.m.
Of course, please have this number and please wait for the moment.
Thank you.
Number 4249, please go to examination room 1.
Let's start with you, Puan Aina. Your test shows that you have a condition called polycystic ovary syndrome or PCOS.
What exactly does that mean?
PCOS is a hormonal disorder. One major system is irregular menstrual cycle, which means you may not ovulate regularly, or in other words, your ovary does not always release an egg each month.
Yes, sometimes I go months with the period.
Exactly, that is a key sign. We also found a small cyst on your ovaries, which interfere with the normal development and release of eggs. On top of that, your androgen levels, which are male hormones, also higher than normal. This can further block the ovulation.
So, she's not releasing eggs regularly.
That is right. Without a major egg, fertilization cannot happen, which explains part of the difficulty you were experiencing.
I see. And what about him?
Encik Hakim, your semen analysis looks good. Your sperm count, shape, movement, and all within normal. Your testosterone level is low.
I have noticed that I feel tired all the time, and my interest in intimacy has been low.
This makes sense. Low testosterone level can reduce libido and may also affect sperm production in the long term. Even if things look normal now, you also mentioned you were having a high stress job, like the increased cortisol, stress hormone. This can suppress testosterone and disrupt your reproductive hormones.
So, it's a combination of both our issues?
Yes, Puan Aina doesn't ovulate regularly, and Encik Hakim hormonal imbalance that will reduce the chances of fertilization. Together, this greatly lowers your chances of natural conception.
Welcome to the option department, Puan Aina and Encik Hakim, right? Now that we've identified the problems you'll be facing, let's see how it will affect the menstrual cycle.
How long should a normal menstrual cycle be, Doctor?
Typically, a healthy menstrual cycle will be between 21 to 35 days, with ovulation occurring around day 14.
The menstrual cycle has 3 phases, which are pre-ovulatory, ovulatory, and post-ovulatory. During the pre-ovulatory phase, your body increases estrogen production, which stimulates the production of luteinizing hormone (LH) and follicle-stimulating hormone (FSH). Around the middle of your cycle, where the LH level surge, proteolytic enzymes are secreted by the follicles and form holes where it will move out into the peritoneal cavity through the stigma and quickly captured by the fimbriae, which are the ends of the fallopian tubes. Every month, Puan Aina's ovaries will produce a group of eggs, and one of them will mature into what we call an oocyte. This oocyte will then be released from the ovaries during the phase we call ovulation and travel to the fallopian tube, where it will wait for the sperm. Now, Encik Hakim, during intercourse, millions of sperms are released into the vaginal canal, but only a few hundred will survive and be able to swim to the egg. This is the moment we know as fertilization, where the sperm will bind to the outer layer of the egg. In order for the sperm to penetrate the egg, it will undergo a process known as capacitation, where the cap-like structure at the head of the sperm called acrosome will destabilize and allow a greater binding to the egg. In the capacitation, the removal of steroids resulted in a more fluid membrane with an increased permeability to calcium ions. So, the influx of calcium ions will increase intracellular CAMP level and thus could increase the motility by hyperactivating the sperm. Only the capacitated sperms can penetrate the outer layer of the egg and undergo acrosome reaction, where the acrosome of the sperm releases its enzymes in order to digest its way into the egg, effectively reaching the plasma membrane of the oocyte. Once it does, the egg seals itself or becomes impermeable to the other sperm in order to prevent other sperms from entering. Well, Puan Aina, if more than one sperm penetrates the egg, we call it polyspermy, and it becomes a problem when we understand that a human zygote has 46 chromosomes, 23 chromosomes from each the egg and the sperm. If multiple sperm enter, the zygote may have an extra chromosome set, which can disrupt the embryonic development and eventually lead to embryonic death, where a miscarriage will occur. The egg sealing itself is called the cortical reaction and occurs immediately after a sperm manages to penetrate the oocyte. Thus, the fusion of both the egg and the sperm produces a viable zygote. Over the next few days, it will divide and implant itself into the uterine lining, where pregnancy will officially begin.
You will receive oral or injectable medication. Oral medications help in a similar way by lowering estrogen. If this would not work, doctors opt for the injectable ones. Step 2. Puan Aina ovaries will develop the eggs. Step 3. During ovulation, Puan Aina's ovaries will release the mature eggs. Step 4. Time-sets or intrauterine insemination (IUI) will make sure the eggs got fertilized. IUI is a fertility treatment involves placing sperm inside a woman's uterus. The goal of IUI is to increase the number of sperm that reach the fallopian tubes. It subsequently increases the chance of fertilization. IUI provides the sperm an advantage by giving it a head start. Taking fertility medications in the form of shots to help Puan Aina's ovaries produce several mature eggs. The goal is to make 10 to 15 eggs. It takes about 2 weeks until your eggs are ready for retrieval. The retrieval process is a 15 to 30 minutes procedure. The doctor uses an ultrasound to put a thin, hollow tube through your vagina and into the ovary that holds your eggs. The needle is connected to a suction device that gently pulls the eggs out of each follicle. Now comes the part everyone's most familiar with, combining sperm with your breast eggs. In IVF, the egg and many sperms are left in a laboratory dish to fertilize on their own. One normal shaped, fast-moving sperm is aspirated using a needle. The needle is then inserted through the shell of the egg and into the cytoplasm. Slowly and gently the sperm is injected. The fertilized egg then divides its cells until it reaches the blastocyst stage 5 to 6 days after fertilization. Triple embryos are then transferred back into the vagina uterus in the hopes that at least one will implant itself and begin to develop.